took a call or something, I don't know.
All right, yeah, let's get going. Please rise. Would you recite the pledge with me? I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Why don't we move on and discuss Jonathan's issues? We appreciate you being here and all of the stuff you have sent us over the last few weeks. And we appreciate Carl and Lisa taking the lead on this. And hopefully we'll keep narrowing things down so we see what we can do best. Sure.
Well, I sent out a letter and I gave you a one without a typo on it today. Basically, we all know that, or I think at this point most of us are know that HRC, one of our biggest problems is a lack of providers and a lack of credentialed providers. So you have to have certain education, certain licensure, certifications in order to provide services here to the Medicaid population and for mental health and for Medicare. We have a hard time getting those professionals. There's a shortage across the state. I just participated in a Clark County needs assessment, which was a pretty in-depth report by One Hope United, who did the research there. And they basically determined the same thing, that HRC in that county, as well as in this county, our biggest struggle is providers and the number of them. We have to compete with Terre Haute, which is across the line there and 20 miles away. Terre Haute does not see Medicaid, people who have Medicaid in Illinois. Most of the facilities don't accept people who have Medicaid into those programs. Some do, particularly residential, but we're competing with those employers who receive $260 if they're an FQHC and they come in contact with a client. They receive $260 for that one contact, whether it's 5 minutes or an hour. HRC Medicaid, one of our better payers out of our payers, pays $84 per hour. So there's a big difference in the amount of money coming into an FQHC across the line. We're not an FQHC here. I did look into that, and we, at this point, it looks like we would end up coming out behind because Illinois has a cap on how much they're willing to pay an FQHC for services, and it's at $120. So compared to two, or was it? 2 something across the board, or border. So anyway, what I'm looking for is funding for our providers to obtain their licensures and renew their licensures. So this would be licensed mental health therapists, certified alcohol and drug counselors, and CRSSs, which are certified recovery support specialists. So those are the main 3 licensure types that we need in HRC, and currently our providers are saddled with paying for all that. What my goal is to make the package a better package for employment for those therapists, so we can recruit and retain more. We do have one immediate issue, which I will make sure gets funded regardless, but I do mention it in here because it's kind of one that I've seen come up more than once. And that's where a therapist just simply doesn't have the funding in their personal funds to be able to pay for the licensure. We recently loaned therapists $600 or advanced $600 of future earnings so that they could get the credits they needed in order to obtain their licensure. It was either that or we'd lose that provider and we'd be starting over again with one less full-time provider. The way it works is they can work under a licensed provider for up to 2 years, but if they don't get credentialed during that time, then they have to leave and we have to replace them. So, like I said, we will make sure that happens regardless. I do need funding in order to implement the other ideas that I presented in the letter. They include, we have the licensure issue, which, and it's an estimate, but $13,000 for over the course of 2 years is the total cost. I'm requesting that Edgar County pay for just 53% of the total ask here. And that is because Edgar County receives 53% of HRC services. And so I've been in contact with Larry Yargis and some other individuals in Clark County, and I'm very hopeful that, particularly if Edgar County supports this initiative, that they'll come through and support the other piece of this initiative as well. I think by having that support, it'll really ensure that we're able to secure the other half of this. Anyway, EMDR is a specialized training that decreases the duration that somebody needs in mental health treatment. It's kind of specific to that mental health side. It requires some special training. The therapist will go on a weekend to the EMDR training location. I can't remember, I think it's Kentucky. And they learn how to do a short-term evidence-based intervention practice called EMDR. And it's called eye movement desensitization and reprocessing, which sounds crazy, but basically it's kind of like rewiring your brain. People are going through their traumas in their life and they're looking at lights that are flashing in different directions and little vibrating thumb pads. It's kind of strange, but it's been proven, evidence-based, that this is very effective treatment. It's very helpful for things like PTSD in particular, or processing other trauma, which we know is a pervasive problem amongst the people we serve anyway, is trauma, whether it's from their family or their health situation or whatever. Another portion of this is, and it's a big portion, the $22,700 total for the agency, would be Relias. Relias is a online learning management program system. So it provides, like if you're a therapist, you have to go get education hours to get your license renewed. This provides those education hours, and it provides them on a current basis. So the website is under contract with various providers of trainings who they buy the trainings off of and allow us to access them. We can get approximately 60% of the credits for a licensed therapist using that program. Licensed therapist. And then we can get about half of the substance use credits that way. And then they have certain limits on how many you can obtain in person, online, etc. So that's where the limits come from, or else they could obtain them all using that source. That source is also updated, and so it's going to give us a higher quality of care because it's going to be the most current research and information. The final section, or the final thing I asked for, was a position, a person. We have an issue with providers, and basically I think they need more hand-holding. I think I need a trainer position at HRC that can focus on getting people credentialed and getting people trained on electronic healthcare record systems, because that seems to be a pain point that we have in retaining employees, is the healthcare record system, being able to manage, that systems are difficult. I'm sure Lisa can attest to that the electronic record systems are very difficult to use, so having somebody that can do that training and bridge that insecurity, be able to retain staff, should be very helpful.
You taking questions? Sure. A couple of things. I noticed the leisure and licensure and certification is a 2-year deal.
Yes.
The EMDR training, what will you need in future years? In other words, is this like, if you do this now, are we prepared? Or are you gonna be back to us for other issues?
EMDR, I would estimate after we get these first 2 groups trained, that it would be about 1 person per year that we would be training on EMDR. You have to get your mental health license before you can pursue that additional credential. And the EMDR, I forgot, the big point there is that it shortens the duration of treatment to about half the time that normal talk therapy takes. So we're serving twice the number of people by utilizing it.
So what would that mean? In other words, we can't, I don't think we have the resources to fund you year after year after year. Well, we want to know what kind of commitment we're making. And guys, speak up for the next 3-4 years is what we're looking at.
Okay.
So, and we're trying to look at our resources and say, okay, we're going to do this with this with the, you know. So we need to know what, we don't want to cut you off at the knees and not mean anything.
Yeah.
Right.
So I would say 7,000 a year is going to be the ongoing cost, and that would be training at 1 new person every single year.
So EMDR would be 7.
Yes.
What about the management program, that 22.7? What's that look like in future years?
That's our annual cost.
Okay.
Would be 22.7.
So what happens in late 24 when we say, you know, the money's gone? So what happens then?
My plan is to take the depreciation that we're accruing during the time to apply that to our reimbursable grants, so that as much of that can be reimbursed and to make it ongoing.
In the HR trainer position, what, and, you know, I know that you're looking for Clark to help you here too, but
Yeah.
so are you gonna be able to maintain that position once we're no longer able to support you?
I believe so. The purpose of that position is for a jumping grounds, to be able to have enough providers to keep the money coming in and be self-supporting. But I know I'm going to take a loss on it. That first year, at least, we're going to be working with providers, but they're not going to be fully trained and operational, and they're not going to be bringing in any revenue of their own.
The last question, I'm sorry guys if I'm taking up too much, is when we're looking at commitment, especially when you're hiring a position or you're training people, are we getting any kind, or have you thought about saying, if we put you through this, will you give us, I know you can't make them sign a contract, but are you gonna be with us for 2 years? Are you gonna be with us a set time? I remember my first job, my boss, future boss, looked at me and said, you know, I'll hire you, but would you make a personal commitment to stay with me a couple of years? We don't wanna spend all this money.
Yeah.
Sorry, that's not my decision to say that. We'd like to see an investment in people be ongoing and them not use it as a stepping stone to go to some other county that's gonna give them extra money. And since we've trained them, and then somebody else takes advantage of what we've spent here. It's not fair to you either, especially, and your clients.
No, I am very much in favor of that. At the very least, a personal attestation would give us, you know, I'm gonna honor it if it's me. That's the way I look at it.
Well, we understand lives
If I
change.
tell you I'm gonna
But, you
do
know,
something, yeah.
yes,
Yeah, I'd be glad to.
Did you recently lose 3 therapists? That
3?
left your, went somewhere else? 3?
We recently lost 1 to Horizon Health.
Okay. I thought you lost 3.
The article said 3, but they did not come from him.
Okay,
Yeah.
I know one of them did.
We had,
where's Horizon Health? Get the name here.
1 went to Horizon Health.
Yeah.
So they're gonna still be
Better ones.
serving Edgar County.
I was gonna say, if they go.
That's kind of a win-win.
Yeah, they're doing the same thing.
Except
Yeah.
that he has to start
Except-
over.
Yeah, yeah.
Well, yeah.
But I also look at it as I have a county responsibility to meet, you know, so if we're meeting the need through Horizon Health,
Well, that's long.
then we're still keeping them here, right?
They can find a better job with more pay, they're gonna leave,
Yeah.
which maybe is what happened with her. And they were trained, you trained them probably.
Yeah.
Yeah.
It's
Well,
like
that's
you
what I'm
said.
saying, then
try to
you go
get
somewhere
commitment.
else, and you lose them, and you gotta
Yeah,
pay the money to train them or replace the person.
Well, hopefully this will create an atmosphere
Right.
that gets people excited and that's meaningful. I mean, there's more, yeah, in these times it's stupid to say it's not just money, but it is. You know, if the training and there's commitment and things are going well, that's gotta be a good thing. Now, is it gonna be good for everybody? Probably not.
but even meeting this needs gonna lead to lots of other needs that we still have, you know, out there. But we have to take it one bite at a time and look at it.
Other questions, guys?
So, you know, we've got the figure for what you're asking for this year.
Yes, sir.
So I guess for next year, what do you anticipate that figure would be? Would you come back next year wanting additional funds? And then also, is your source from Clark County that's basically paying 50% of it,
Yeah.
are they willing next year to, you know, come up with their 50% possibly?
It would be helpful if I had some kind of idea whether it's likely that you'll support this or not. It would be helpful to have that in order to feel out the Clark County person a little better on the next year. At this point, I can't really tell him a
Right.
commitment
Right.
either way.
I know I'm 100% for helping you this year, and I think most of the board feels that way. I haven't talked to everybody, but you know, if also, do you know what that figure is for next year? Do you have that figure now, or do you need to get back with us?
As far as ongoing expenses that these would create, I'm looking at $23,500 a year is what it creates ongoing.
23.5.
Yeah,
So next year you would maybe request 23.5 from us, or total?
well, I wasn't assuming that the money would be with you guys next year, but
Right,
if you had it, I would request the 23.5, yes,
from Edgar County.
yes.
And then hopefully Clark County would be on board and you'd ask them for 23.5 or
Yeah.
roughly.
Yeah, and,
Okay.
you know, if Edgar County, if the county wasn't able to support it next year, then I would talk to either Edgar County, or Edgar County United Way, or one of the other organizations that we write to and request funds from.
I'm willing to do it make a 2-year commitment. And, you know, obviously through this jail study, you know, things have come up and, you know, that's part of what started the conversation,
Yeah,
to improve things for Edgar County, and I'm willing for a 2-year commitment. And, but I'd like to see, you know, get maybe a year from now or 6 months, well, a year from now, because it's gonna take you a while to implement everything.
yeah,
But just get a status of, you know, what results are you seeing from this?
Right.
And then possibly, you know, the 3rd year, you know, if we see there's good results.
yeah, if it's effective, then,
Right,
okay.
yeah.
I mean,
I'm willing to do a 2-year commitment. And this, you know, if you see this, it's roughly 62,000 this year for Edgar County's share, and then next year would be 23.5 commitment. So a total of 85,000 roughly,
So the
Over 2
second
years.
year commitment's about
23.5.
23.5?
Right.
Sorry, I was,
Yeah,
pardon me for being
Right.
absent. Now, when do you see that starting at the beginning of the fiscal year? How do you want to see I mean, it doesn't matter.
well, your fiscal year is different, isn't it?
Yeah,
ours-
that's why-
Ours
Yeah.
is July 1st.
Yeah.
Okay,
And
well,
ours,
yeah, ours is November, but that's fine.
Yeah.
I mean, we're, you know,
And I would shoot for an implementation date of January 1st.
you mean starting this January
Yeah.
1st?
Yeah, as far as gives us plenty of time to implement it and communicate the benefit, because that's the main thing, right, is communicating, hey, we're gonna do this for you.
When
Come
do you
work
need the
here.
money in your hand?
Between now and January first.
I just want to make sure, because I want to see when we need to get this. Obviously, it's not on the agenda. And other comments, how does everybody else get?
Yeah, go ahead.
I was gonna ask, you still have the program if a mental patient comes in the emergency room and they have no way of transferring to somewhere else? You still have that room and the person available? in your-
Yeah,
in
we
your
still have an
building?
LRP program is
Yeah.
what that is, and they are there. They are not available 24/7.
Well, okay, I knew
But,
that, right.
but during the day, they are there, and we're just waiting for people to walk
I
in.
know when I worked in the lab, we did have mental patients would be there for 2 or 3 days because there was nowhere for them to go.
Yes.
If your program, that would make a little difference there in that.
Yeah, we work pretty closely with Samantha McCarty
Right.
from the hospital, because that's part of the objectives with that program, is to make it to where people aren't just sitting out ER bed for 3 days waiting for a hospitalization. That's still a battle with a
Oh, I
few
know,
individuals
yeah.
that we have trouble placing,
Right.
but to a large degree, I think we're very successful. We've
Okay.
been getting people placed within like four hours on average,
Okay.
and the average in the state's 72 hours,
Good.
which is a significant difference.
Other questions, guys? Miguel? Guys, yes, I treat it as Jonathan, I'm really impressed with what, I think we all are impressed with what you've come up with. We feel very good about it. It's been quite an education. It all started with, we need a new jail, and it's evolved into, there's just no simple fix. If you need to have a combination of things in place to make this thing work. Just putting in a new jail or a new this or a new that is not gonna solve all the
People
problems.
sometimes don't realize that either.
Well,
They think, well, when are you gonna get the new jail? They don't think about everything else that goes along with it.
What?
And you can't explain it to them, because, yeah. And why
we're
we
gonna
don't know
try.
either.
We're
Yeah.
gonna try, and I think the newspaper will help. I think
Right.
articles to the editors, to the letters to the editor, and the position that the paper takes and other people take, I think people are starting to understand. I think they are, and it's gonna be an evolution.
Oh, you know, you're putting money out, and I hate to I don't mean to sound cold saying it's dollars and cents, but if you can relieve one part of the system by actually taking care of the problem rather than pushing it into another part of the system, then it's worth the money spent.
Absolutely. And, we're gonna be dealing with issues here, other issues in the budget, such as the judicial system, as far as the prosecutors and,
Bonding. I mean,
well, bonding's gonna take care of itself. I was thinking about the public defender. I mean, there's a lot of issues that are not working as well as they could be.
Because they're overwhelmed.
Right.
Right.
So part of our education and part of what we do has to take all those moving parts and try to make it work, which is what we're gonna talk about here in a little while, probably in closed session, because it'll have to do with specific individuals, but
So while we have Jonathan here, another part of what Carl and I had talked about with you was what your needs would be in a new, say, public safety facility.
Yes.
Want to share a little bit about what your conversation was?
Sure. I did bring a printout. I didn't bring enough for everyone, but I did bring a printout of what that looks like. We were needing a space to meet privately with inmates. Essentially, the key difference between that and what we've had in the past would be the ability to turn off recording equipment. audio recording equipment, and that's for confidentiality, you know, patient therapist confidentiality. Oh, yeah, the back pages are, yes.
Okay, I emailed that, I'd be more than happy to hand that out to everybody.
Oh, sure, that'd be great.
Okay.
Yeah, it's like the last 3 pages, it looks like there.
Okay.
So a space to meet with inmates. I think most cost effective, I mean, I'm thinking jailers are the most expensive thing that you have to work with there. So most cost effective to me would be to provide like a plexiglass barrier that you can talk through, you know, has holes or whatever to talk. So the inmate and the therapist can be there and they don't necessarily have to have a jailer tied up the entire time. So that's one of the things, and I think that'll serve well in the jail anyway, because you're already gonna have to have a place for lawyers to meet people. So that'd be a positive thing for them to be able to turn off recording equipment and meet. There's a picture of kind of what one idea as far as how to make it work. I'm not an architect, so, you know, I leave that up to the jail, or the, you know, engineer on the jail. But you basically get the idea that there's a wall, a divider, and then there's a computer screen facing the individual and one facing the therapist. And basically a therapist on one side of the wall and the inmate on the other. Basic idea. By doing it with the computer being there, it would allow us to connect using telehealth, which can be very helpful and can get us on scene a little quicker. It's a lot of agencies use it for additional suicide screenings and things. So it would serve that purpose, both in person and telehealth. And finally, a group room space. I think that was finally. Yeah, a group room space would just allow us to meet with particularly those that are incarcerated currently who need substance use treatment services. We can do group sessions in a setting where there is a group session working, basically. That, I could see that could potentially tie up a jailer. I don't know if we can shackle people to their seats. I don't know what the laws are with that, honestly, when you get into incarceration stuff. But we have done groups in the past, and we're able to.
And we had a meeting with the sheriff and some of his people, and we shared those 3 things with them, and they think that was something that we need to implement in the new facility.
I felt like all 3 of them were really a win-win type of situation. I mean, it's going to serve HRC, Horizon Health can connect telehealth, attorneys, you know, it's
Right.
multi-use.
Right.
If I could, I think I would ask Augie to include it on the October agenda. I know you said you need till the first of the year, but our commitment might help you with Clark County if
Yeah.
we went ahead and activated the plan, and then we can deal with the funds at the appropriate time, but to go ahead and put everything down and get things going.
Okay.
And that way,
Then I can
our
contact Clark
commitment
County.
could be used to build them.
Yeah,
Okay,
that'd be
does
great.
that make sense, guys?
Does everybody feel that we need to support this program?
Oh, yeah, I think so too, yeah.
Okay. So at any time, you know, Carl and Lisa will remain the committee, you know, so that as things evolve, or if you have concerns or questions, they're available. You're always welcome to be here. Okay? I think you know
Thank
that.
There's a couple cards, I only have 2 on me, but anybody that doesn't have my information, you can have it there. She is, I believe she's still at Carl. But she's waiting on transfer to IU. She's been waiting on a transfer for open heart surgery for going on 2 weeks, I think. Yeah, that's bad.
Well,
See
thank
you all
you, John.
this.
All right, thank you.
Thank you.
Appreciate it, John. You take care. Well, moving along,
Uh,
boiler man.
Yeah, I was hoping he, well, I ran into Dustin, they're gonna have to, basically, I contacted Sycamore, they haven't gotten back with me. He said he would look at it. First Refrigeration got back, they don't make boilers that size anymore, so he said it would take two. But, he didn't have a figure, on it. I think he talked like the cost was around 10 grand a piece, but that's not installing or anything. So hopefully
What put in the health department, want to replace that?
they put a boiler in there. Since that time, I mean, and it's
small.
It's very small. He said that's one thing about the new ones, they don't make those great big boilers anymore. You stack them depending on how much you need. And it would take two smaller boilers that would go down the stairs. He goes, the other one's gonna have to be broke up and carried out. But yeah, it's just smaller ones. But I'm still waiting on him to get back with the price, but it not quite as bad as what I envisioned. I mean, I had visions of,
$50 a piece or something.
well, yeah,
But you still, at 10 grand a piece, you need 20, you're probably still looking at 40, 50 to get them in, right?
I would say probably 30.
30?
I think so.
Okay.
I'm hoping, but we'll see. Depends on what all's involved with that, so.
Then we talked about,
And I should know something by Wednesday.
And that's from Paris Refrigeration,
That's- yeah.
but Sycamore hadn't.
They haven't got back with me yet.
You still do that work, Paris Refrigeration? You still do the work?
Yeah,
Just know the grandson doing the work?
it's the grandson, they've got some help.
Okay, that's not, but he's not capable.
Of Don.
Yeah.
Don's still there.
I know he's still there, I got, yeah. Yeah,
But
then we're waiting to hear from the architects and, what's the one, it was,
Michael,
yeah, Michael. and
Basinger.
Basinger, and then we have one that's supposed to give us some estimates on costs.
Right.
On the courthouse and how to proceed. And we're just kind of collecting
Collecting
information.
data right now, and when we get all that, we'll
get back. That would be the roof and the elevator system. We're still looking at both of those. Yes, sir.
they're still talking about putting the elevator on the outside of the courthouse.
not on the outside, but relocate. I don't
Okay.
think it can be, you can't put a ADA elevator where that present one is right now. It's just, you can't make that shaft any bigger than where it is.
And I had concerns about flexibility if you put the elevator in, and I've had my fears quelled or lessened, because the elevator probably is gonna have to go in and then you figure out what else you're gonna do. So, at any rate, we'll come back to you, not make any rash decisions.
As soon as someone gets back with us, and
And
we'll
that should
get all the
be-
data.
Right.
So what is it about the current elevator that's not ADA?
The size.
So it's not that the doorway into it isn't big enough, right?
Honestly, I'm not sure. I'd probably need to get with someone and say, why is that not ADA?
I just wondered.
I don't know, can you get a wheelchair in there?
Yeah, you can get a wheelchair.
But we're not,
That's why.
currently, we're not required to make a change with the current
Elevator.
elevator, are we?
The thing is if that one breaks,
Well, right.
then you're,
And you're not grandfathered in. You
yeah,
can't,
you can't go.
once that's gone, it's gone.
Right.
But, yeah,
So at this point, you're trying to be proactive on that.
right. Because if it
Not
breaks, then,
stupid though, just proactive.
right. So,
Okay, don't say nothing. You
I mean,
can
it's
straight lines.
I don't know, yeah,
We just wanna let you know.
It's 50 years old,
50 years old.
and around 70
Yeah.
is when it's put in.
There's a lot of ups and downs.
That's
Oh.
cute, that's a sick joke.
Wasn't meant to be a joke.
Ups and downs, me, ups and downs.
Anything else?
No,
Beautiful.
right now.
What's-
years up to then.
What's going on at the, how are you guys doing out at the
Animal shelter.
animal shelter with trying to figure out how to be proactive with that and
She's doing fine.
You're doing great. I talked to her the other day about budget, she's working on that.
well, and I mean, also with the pet neutering. Remember,
Well, we haven't done much on that yet.
No, I haven't got much from her
I
yet.
mean,
we
I know
really
she's
need that
working it.
budget this week.
I told her to work on it. So,
Because I'd like to get, well, that's another thing.
yeah,
Anything else?
no.
Russ,
And nothing.
what are you hearing there?
I wanted to share with you, you know.
All of us or just me?
Oh, no, all of you. Vermilion County, Indiana has this really nifty van that has, it's wrapped and it has sponsorship on it. I don't know if you can see what that is very well. I'll just share it out.
I like that word.
Nifty.
Oh, cool. I like that.
1940s, nifty.
Yeah. So I don't know that, I just thought that was
It is nice,
interesting.
What is it? What type of van?
Van for.
Carpet van.
Got the, animal shelter, or whatever it is,
Yeah, that's right beside our jail. And a pasture that we rent. But, and it says opt to adopt, www.pvchs.pathfinder.com. And it's also got some sponsorship from PetSmart Charities. So if at some point you decide you want to look elsewhere, they've got it figured out on funding. When the truck, because it's a truck, right?
yeah, pick up.
When the truck dies, you might want to look at that.
Okay, well, the truck came from here, so.
Oh,
probably
it was
about
none of
miles
those.
long.
Yeah.
It was
Anyway, I just thought that was pretty
Yeah,
interesting.
yeah.
Well, our animal shelter works with the Vermilion County
Yes, it
Animal
does.
Shelter a lot.
Yeah.
They get a lot of our animals,
Right.
you know,
Russ, do you have anything? Carl?
Donnie Wright at Foytz's, I was talking to him a week or so ago, and I don't know all the details, but he's getting some pushback or something from our engineer on the tank. What?
It's all settled.
Oh, is it?
Yeah, what they did was, there was deducts
Right.
because of time and
Right.
everything else, so they all got together. I think we said that they were gonna get hit up like for 71 grand.
Foytz's was?
Right.
Yeah.
It boiled down that they accepted 51.
Okay.
Because of problems with the project and so forth, and they all signed off on it.
Okay.
I wasn't involved directly or indirectly, I just know what had happened, that the engineers and the state were holding them accountable for certain issues that had taken place.
Delays?
Delays, electrical issues, that type of thing.
Up at the airport,
Yes.
when they put the fuel tank system in and all, expanded that area.
And they didn't have to pay that. In other words, if the contract was 700,000, then they just, it was deducted off
Right,
the total
what they-
cost.
Yeah,
Right.
what they got.
Right.
Well, he just said there were some issues and I wasn't aware of it. I thought that all had been settled.
It came and went, just,
He thought I was on the airport committee. I said, well, there isn't a committee. Jeff's the only one that does that. I said I'd bring it up and see what was going on.
yeah, it was settled about a week and a half ago or so.
Okay, about 2 weeks ago when I saw him.
And they just made me aware of it. That was it. In
Okay.
fact, that's on the list here.
All I got.
911 met with the mayor and
You
talked
that.
about joint dispatch, and they're working on it. The mayor, I think, was fairly forthright that they're interested in seeing what economies could be accomplished by combining the city dispatch with 911. Troy was there, who was chairman of the 911 board, and clarifications, I think, were also made that the mayor stated that they were still interested in looking at putting the city police department into the jail. So everybody came away, I think, knowing who was committed to what, instead of me just hearing all the time directly from the mayor and everybody wondering, well, is Jeff interpreting it right? And I'm not trying to be defensive, I'm just saying it was better to have a situation that clears the air. The police chief and Troy will start working more closely together, and with the sheriff or his designee, meaning Derek, and trying to work out details to see what can be done about combining those different agencies, noting that we don't have to wait for a new jail to start sharing or, doing the economies that need to be done, that it could happen a lot sooner than just waiting for the new jail. City taxpayers are paying for both dispatches, which I think they should consider, and as long as economies can be made, then we ought to look at that. So that's where we're at on that. Did I represent that fair?
I have a question. I still have a question. So how's it work now if you're in the city of Paris and you call 911?
It comes into the jail, and when they answer the phone, they realize it's a Paris police matter. They say, wait a minute, they transfer the call over to the city police department. She picks it up, takes the information, and then she dispatches out the Paris police officers. But other than the Paris police, the county, the sheriff's department, when a 911 call comes in, no matter what it is, other than Paris police, they take care of everything.
Including Paris Fire.
Paris Fire, ambulance, yeah.
And so Paris Police is staffed 24/7 also with one
Right.
person?
They got one dispatcher
One shift.
on every shift. Right.
So you would take that link out, if it's 911 answered, at that point, it's not Paris, or, if you're at.
I mean, if you have combined dispatch,
Pardon?
if you have combined dispatch, yeah.
Then they don't, wait a minute, we'll transfer you over to Paris, depending on what the situation
But
is.
the
They just
dispatcher just
handle.
handles it and dispatches the appropriate person.
Efficient.
So other than for the length of time it takes to resolve the call with the dispatcher, it doesn't increase the workload of the county's dispatcher.
Say that again.
Other than for the amount of time it takes for the 911 dispatcher to handle a Paris police call,
Right.
it would not increase the amount of workload on a county dispatcher
Under the current system.
if they were combined.
Oh, if they're,
The only difference is the amount of time it takes to resolve a call to the
Right.
city police.
well,
So,
Should still be making.
It's not that simple.
no.
It's
Okay.
not that simple. And that's what they're gonna try to work out. There's all kinds of other calls that 911
Yeah,
and
Yeah, less than 10% of the phone calls that they get are 911 calls. There's all kinds of other, just regular business calls, and then, running license, running all the stuff that the deputies or city police officers would request.
so the city's still gonna have to have that person on staff 24/7.
If we had combined dispatch.
If we had combined dispatch though, they just wouldn't handle the 911 part.
no, there would be no dispatch in
They
the
would,
city.
yeah, it would be all in one
And so
place.
that's why it would increase the workload on the county person.
Well, the
Yeah.
county would be city and the city would be
Right.
county. And then
Right.
we would probably have 2 dispatchers on every shift, maybe a third one, depending on
Right.
what, and we're gonna be looking at call volumes and what those calls are and all that business, and that's
Okay,
what
'cause I
they're.
was only looking at, when I'm thinking of economies of scale, I was only looking at the dispatch portion.
Well, both both agencies are spending, let's just say $250,000 apiece on it. We may be spending slightly more. Okay, so can we save money? What can we save? How will they operate it? Right, Carl?
Mhm.
And those are questions that we don't have all the answers to yet. Okay? But we do know currently that they're spending between 500 and 500, the county and the city, about better than $500,000. Okay? And we need to do whatever it takes to still get the job done safely and efficiently and see if we can save money now or at least control the costs in the future. Does that make sense? Good. I don't know what the hell I just said.
Well, you're also, you're just looking at labor costs. I mean, there's equipment costs,
Oh,
there's
yeah,
building
yeah.
costs, there's
Yeah.
a whole lot of other costs
Yeah,
too,
can it-
savings.
Yeah, and it can it all be housed in the current situation? It'll also be kind of like a guinea pig, if it starts sooner than later, about what we need or don't need, and whether it's justified to put in the new jail. I mean, there's a lot of things that can grow out of this if we handle it correctly.
So it'd be nice to get it done now, if we're going to do
So
it.
that's my opinion. I don't know whether everybody shares
This,
that.
this new building or whatever we do could really be a unique deal.
It
And
could
that,
be.
that's the way we need to look at it. Incorporate everything we can.
But call volume wise, the city police, they have a lot more calls than the county would, even with 911. I mean, it was in an article in the paper on the city council, you know, the mayor's having a police chief report the number of calls they have, the arrests, you know, stuff like that, and I don't remember what the figure was off the top of my head. But I know from past experience, the city has a lot more calls for service than the county does.
Thank you.
So by adding that to the county, you know, that's putting a lot more workload, and, you know, then you gotta see if you got the amount of personnel to handle it. You know, because we don't have, like the county currently, not all shifts have 2 people. Some of the shifts, maybe half the shifts have 2 people, but the rest of the time they're just 1 person. When you throw all the city calls in, 1 person can't handle it. Especially like if you get a 911 call and you have other calls coming in, you know, your priority obviously would be with the 911 calls.
But that's an advantage to us too. I mean, rather than having 1 person, now you've probably got 2 people there all the time.
You would have to.
I mean, it's like,
And 3 to 11, there might need to be 3.
right.
I mean, that's why it's so important to look at all the shifts and where the calls are coming from and what they're doing, you know.
Or if they keep any kind of a study on that, do they? That'd be.
According to the mayor, I don't know.
The city is now.
Yeah.
County isn't. And I thought about this weekend, I'm gonna get with Nanette and the sheriff and have them start doing, 'cause back when I was there, we did do that. We did a study for like 6 months, to know exactly, you know, what day, what time is your busy times to just
Right.
see, but we need to do that.
Be pretty,
Because the city's doing that, but the county's not doing it. But now, 911, she has the capability with her records to know what the 911 calls, but like I say, there's so much more of the calls are not 911 that you have
So
to
they're
handle.
non-emergency calls?
Oh, yeah.
How do we,
License plate numbers and stuff like that.
well, I know leads.
10% of the actual calls they pick the phone up might be 911. The rest of them are all kinds of different
Are
things.
people calling 911 but not for an emergency?
No,
Or you're saying the other line?
the other lines, you know, there's 4 or 5 other lines in the jail besides the 911. Yeah, there's all kinds of other calls going on all the
Yeah.
time.
And that's all through Nanette? The other phone calls?
No, the
No,
dispatchers,
just
not
the-
Nanette.
Not Nanette?
They're, you know, because they're sheriff dispatchers, they're
And I
not.
guess I'm having trouble, which you're explaining it well, I'm having trouble grasping. We're talking dispatch and 911, 2 separate
Different
things,
things.
but we're gonna be talking about
They're all-
combining them all together.
They're all together now.
Not the cities. See, she's dispatch of the city is different than dispatch functions of 911. Okay, right? I mean, we're talking 911 in the county. County employees are doing both 911 and dispatch
For the county.
for the county. The city has a completely different entity that dispatches in a
Right.
different location. We're talking about bringing them all together and see if we can't operate with some economies and efficiencies improved.
So you're gonna be doing, so there will be data collection on county 911, county dispatch, city 911, and city dispatch.
Well, city doesn't do 911.
Well, they receive them though, they
Right.
receive
They-
911
Yeah,
calls.
they don't get the initial call,
Right.
but once they realize it's
An
Paris,
emergency, I guess I should say,
then
instead of
it's
911.
transferred over to them, yeah.
Just clear as mud.
I like data.
Yeah. Well, the city collects and we don't, and that's what I was speaking to earlier. So, anyway, anything else, Carl? Phil?
Augie and Jeff and I met with the county, some county elected officials and department heads to look at the rough draft of an revised HR manual. I thought there was a lot of good conversation that came out there. It was really helpful to have Mark there.
Mhm.
Guys, so, and so some things were procedural and some were changes that are needed, and some were the fact that we need to make some clarifications and that not all departments interpret things the same way. And so Augie has the task of compiling information to send to Bellwether to come up with another draft. And Angie Barrett was not able to be there because she was at a funeral, and then she sent comments and questions later, some of those which we had discussed and some which we had not. And so once Augie is able to get that information to Bellwether and they come up with another draft, then we will meet again.
Yeah, the.
The elected officials and
Right.
department
And
heads that
then
want to be
after
there.
that, the board will get the final draft, give you a few weeks to take a look at it, and then we'll take action. Budgets are due in. I've got most of mine in. I have no idea what it looks like. We're gonna try to have you a rough budget at the next study session. We worked on the levy. It looks like the levy would be the FICA or the Social Security levy is gonna have to go up a little. We programmed in so far, of course, it's up to you to decide whether ultimately we do, but we dropped the general levy a little bit more, just like we did last year. I have not heard from the health department on their levy, but I've communicated with them and I haven't heard back. The HRC levy is up, I think, $17,000. So we could be looking at something under 0.005% increase in the levy, but predominantly would have not much to do with us except for the FICA levy, so the Social Security levy. But I'll try to get a rough draft of that out to you at the end of the month. Also, it just depends on what Augie has to do, because he usually types that up for us. Right, Augie?
Yes, sir.
Let's see, the airport, people don't have regular office hours anymore. Got a telephone call from the aeronautics yesterday, and I got an email this morning at like 5:30, 5:45. I said, don't you guys have lives? At any rate, but I shouldn't have said that, because we have another $31,000 headed to the airport for assisting us in operation, under the doors and so forth. And Tom's already, I saw one of the emails I got, had Tom asking some questions about what we need to do to get those funds shipped our way. As far as the runway, or I'm sorry, the taxiway, they pretty much come to an agreement on how we're gonna, or what we're gonna do. We just don't know who's gonna do it yet, but hopefully that gets resolved here in the next week or so.
Yeah.
Remember that the taxiway kind of fell apart. They're talking about using a filler to mix that will solidify that. I don't understand. I'm like Jonathan, I'm not an attorney or anything else, so I don't, or an engineer, but they're starting to work on that.
Yeah, I was just thinking about that this morning, we're gonna be running out of time.
I know,
The weather's gonna get us.
I talk to Barry about every week and go, what's happening? And he goes, well, aeronautics moves slow and they have to approve it all, so.
Maybe mix a lime and cement or something next year.
Yes. And in fact, that's exactly what it was. And in fact, we had suggested that 3 or 4 months ago, and, you know,
They
a
did
lot of
it
hand
out at
wringing.
the
and-
school when they were building it.
Right, so that would make it much easier, and then they would mix it. In fact, there's a machine that actually does that we suggested early on, and, well, you know, how engineers are. At any rate, you can quote me on that one.
What about the drainage?
That, the drainage issue needs to be,
Yeah,
that'll be part of the deal, so, yeah. Because without drainage improvement,
You're still
no
in that
matter what you're
situation.
gonna do, yeah. So, at any rate, so I wish I had better news where that's concerned, but I do not. We need to talk, and I don't know whether there's time yet today or we can do it Wednesday, to go into session, closed session, about personnel as far as the public defender / state's attorney, assistant state's attorney. What's your, I don't even know what time it is.
5 to 11.
Yeah. So you wanna try to hit that Wednesday morning a little bit? I mean, there's no, or do you wanna try to do that? It's up to you.
whatever everybody wants
I'll
to
do
Yeah.
do.
it now.
All right, let's,
I mean,
we got a little
Okay.
time?
We've got till 2 o'clock.
Oh, well then, as long as you've got time.
You may not on Wednesday.
Just keep it up.
I will.
Yeah, Wednesday I might be short on time.
That's fine, that's why I
Yeah.
asked. Okay,
Farm reading.
Yes.
Nothing but
Need a
time.
first.
what?
Need a first.
Well,
Well, wait a minute, I was gonna ask you if you had any
No, I'm good.
things that you wanted to ask. Yes,
on the agenda is the
Yeah.
summer food program.
yes.
We need.
I have called and called. I have not gotten a call back from her, so I don't know where we sit on that. Thank you for, wrong agenda.
And Amanda said that unless something's going on in Douglas County Health Department, that she plans to be here in person on Wednesday.
Well, yeah, I put on the agenda, you know, request for approximately 23.3. It's within a few dollars of that, so I don't know whether we want to move forward with that or we want more. I think that what we need to do with the jobs program is find out if they will help us next year. I don't think they can probably do anything for us this year because budgets are already, you know, we're past the time and probably won't be any
So
retroactive.
we're not gonna count on them contributing to that 23,000
But
this year.
next year-
This year.
Well, and we could always pay it, and if they decided to reimburse us, that would be a different story. I don't know, Carl, what you want. I can't make them call me,
Right.
so
Who have you got to call into?
the executive director of the jobs
Okay.
board
Okay.
that, remember,
Yeah.
Amanda talked about, that was able to give them some funding.
Yeah.
In Douglas County through the Champaign office, but this is the Effingham office that deals with us.
Okay.
And Amy has not called me back yet, so, you know, I'll still try to call her this afternoon and see if I can get anything. Let's see what else is on there. Authorizing,
So I guess if that's not gonna happen, or we're gonna have to decide, are we gonna pay the 23,000?
right, that's on the, yeah.
Yeah.
So, what's everybody's thoughts, or?
Pay it.
Well, if we pay it, and does that affect, do you think that'll affect whether they give us any money or not? Can won't.
You mean in the future, you mean the Job Corps?
Yeah.
I don't think so.
Okay.
And we pay it out of the funds, the meals funds that we got from the rescue plan. It wouldn't come out of our budget, okay? That would come out of the same budget that we're talking to HRC's 62,000. So it wouldn't affect our everyday budget, but it might eventually affect our long-term commitments to things.
All right.
But,
There we go.
yes, you gotta go?
Yeah, but I gotta go to the bathroom. I'm not back in a half hour. Go ahead and
We'll send,
keep going. Okay.
Okay. Let's see, what else? Did you include in our envelope packet the 911 dispatch agreement? Okay, I didn't know, I didn't
Yeah.
look. The only other thing, Carl, I have about that is for the budget, that's just through the end of the year? What, does that mean January, or December 31st? Or the fiscal year, or what is that?
What's it? We don't have a copy of
Yeah,
it,
you do.
do we?
That's what I was asking.
Supposed to have.
I haven't seen the thing, I don't know whether it's
The
November
reason I
30th.
ask is in building the budget
Right.
on,
Through November 31st, 30th.
what will it go to? I guess my question I can ask you later, Carl, is what is next, what does it go to after this fiscal year?
Well, we just have to, well, we know what the healthcare costs are gonna be. Of course, we don't know what the individuals are gonna choose, you know, the 6 individuals, that, you know, that will affect it. There's a 2% pay increase that will be added, and then 6 months of that extra dispatcher will be added on, and, I'd have to do some figure.
That's fine.
It'll be 30,000-40,000 higher, but I'll have to do some figure.
All right, that'd be fine. I mean, I got a little
Give you a
time.
ballpark.
Yeah,
figure.
all I need's a ballpark, and if it's not quite right, it'll be fine.
Yeah.
I just want to double check. I guess. Okay. Let's see, oh, and we're gonna look at the COVID leave policy that we passed last year and reinstituted for this year, at least through 11/30/21, to make sure that everybody's clear on how the policy should be operated. That's included in here too, isn't it? So
Yes.
if you would take a look at basically, for example, if employee A gets COVID, we pay them for 10 days of time, up to 10 days of time, without accounting against their vacation time. And then we can turn around and reimburse ourselves out of the COVID rescue plan. So that's something to consider. We did that, yes, sir.
You say vacation, does that include sick days?
I'm sorry, I meant sick, all of it,
All in,
all of it.
yeah.
That we would
Right.
stand that responsibility. Okay? We did that last year, and so comments, think about that, and we'll talk about it tomorrow. I just want to make sure everybody had an opportunity to think about it. I have talked to some of you because I've run into Russ and Phil. I'm sorry I have not, but
Sorry, I'm not hurt.
okay, that's good.
I've always got a dinner to listen to.
Yeah. All right, anything else? I'm sure there's plenty of things. The things are not as simple as they used to be. There's a lot of things, a lot of moving parts now. Motion to go into closed session for personnel. Andy moves. Russ seconds. All those in favor signify by saying aye. Opposed, nay. Okay. It does pass.
Hey,
You can't believe all
Yes,
the
it is.
crap I've got to do yet today.
Okay.
Any other business to come before the board?
We need to meet and come up with a solar committee meeting, which I'm sorry, I learned my lesson. So that's the next thing.
What'd you screw
What
up?
do you say?
Well,
Nobody
I,
screwed anything up. It's
No.
just-
I
Okay,
just
what
didn't
did you
make
do
it, I
right?
didn't verbalize it to Augie or put it in writing that I needed to have a committee meeting
Oh.
posted.
Okay,
So I knew it, and Russ and Derek knew it,
Learned
but
your
I
lesson,
didn't,
didn't you?
yeah,
okay.
And if something is important, we gotta do that by the book, because somebody could come in and
especially
go,
something like that.
Yeah.
Yeah.
It's good.
we're good?
Just gonna let me know.
Motion to adjourn? Andy moves, Phil seconds. All those in favor signify by saying aye.
Aye.
Opposed, nay. One great